Now, 8:09, councillors in Poole are being urged to refer plans to reorganise healthcare in the county to the Health Secretary. Under the CCG's Clinical Services Review, Bournemouth Hospital will become the main centre for A&E and maternity, while Poole Hospital will focus on planned operations. You might remember last month, the Dorset County Council Health Scrutiny Committee, after a sustained campaign by opponents to those plans, did vote to ask the Secretary of State to look at those proposals. Well, today a motion to full council at Poole is asking elected members to do the same. We can talk about this with Jeff Willams, who sent an open letter to the CCG expressing his concerns. Jeff joins me on the line now. Good morning.
Yes, good morning, Steve.
Good to have you there. When you wrote that letter to the CCG, what did you say? What were the points that you raised?
Well, the point I would make, Steve, is that we are a year behind where we could have been. Dorset Council voted over a year ago to refer to the Secretary of State. When it goes to the Secretary of State, it goes to an independent panel that can then, with experts, look at the whole issue. Now, in Poole, in June last year, the council unanimously, on a Conservative Party motion, voted to support the opposition of the people of Poole to the loss of A&E out of our town, and also the loss of maternity. Two councillors then went to the joint committee meeting in Dorchester in December, and that was Jane Newell and Vishal Gupta, both Conservative councillors representing the people of Poole and the Council of Poole. Now, Dorset Council had already voted to refer to the Secretary of State, and they expected Poole to back this because unanimously the Poole councillors said, yes, we support the opposition, we don't want to lose A&E and maternity out of the town. It then came to a vote with 6 councillors, possibly 8, from Dorset, Poole and Bournemouth. Well, we expected Bournemouth not to support the motion to refer to the Secretary of State because they're very happy with the changes. They get a brand new or vastly extended hospital with full suite A&E. Poole councillors, we were sure, would say, yes, we support referring to the Secretary of State, but no, they didn't support it. In fact, if you look at the video,
yeah,
I think it's pretty appalling.
So you're saying that this could have been referred to the Secretary of State a lot earlier, but in terms of your objection to this reorganisation of Dorset's healthcare, the line that we've heard from the CCG throughout this is that this will improve services, improve outcomes for patients in terms of expertise. You can focus that in one A&E centre, and they argue that Bournemouth is best placed to be that A&E centre. What are your objections to that?
This is not leading to improvements. This has been packaged up in language which is enormously misleading to the people of Dorset. We must focus on the fact that we have 2 A&E departments at the moment. We should be expanding both A&E departments, but we've been left with this false dichotomy that we close one down. We've been thrown in the air, and then the battle becomes between Bournemouth or Poole. It shouldn't be like that. We should be developing both A&E at both hospitals, not competing between one another, and such is the nature now of the NHS. And it needs to be made clear, Steve, up front, which the CCG will deny. They are running down the budgets in Dorset by 147 million every year. That is the target. That's their mission, to reduce the overall budget by 147 million. And that's what they're doing. If you look at the overall package, we lose A&E in Poole, we lose maternity in Poole, we lose 400 beds in the hospital in Poole, we lose 250 beds overall throughout Dorset. We're closing 4 community hospitals. We're closing doctor surgeries. Where I live off Ashley Road, we closed one of two doctor surgeries. And if I may add, what's happening then? They're selling off the land and the buildings to the commercial markets. I mean, it goes vastly beyond this hospital issue. It is an enormous reduction in funding for the National Health Service in Dorset, which the Clinical Commission, Tim Goodson, will not accept.
Well, look, Jeff, just to say that the CCG have replied to your letter and they say that your concerns are based on misinformation being pushed around in the media. They've offered to meet you to discuss this matter further. By the way, the vote tonight is a kind of complicated one. So you've got this motion from the Poole People Party. But there won't be a vote as such this evening. It's more likely that this issue will be sent to the Poole Health Overview Scrutiny Committee to consider referring this to the Secretary of State. Obviously kind of complicated. We will send our Dorset political reporter along to that meeting tonight and bring you any updates on this show tomorrow morning. It's 8:15, breakfast in Dorset for a Tuesday morning. And our news headlines then this 13th of November. A motion to full council in Poole tonight is calling for a rethink of plans to move A&E and maternity from Poole Hospital to Bournemouth, as you've been hearing.